Um, First, I just want to start by thanking everyone on this panel. Senator Mosley, Sarita, Daftari Steele, Vinny Shiraldi, Tahini Dunn, Sharon White, Dr. Bobby Cohen, Corey Stoughton, and Mr. Marcus Brown. I just want to thank you for joining this panel today and this webinar, just to share your thoughts and to give some analysis, to share an analysis around COVID-19 and technical parole violations. I know each of you in your respective engagement and work have done something about this, is in action with doing something about this, and is looking to empower others to be exchange agents to make the conditions better for people on Rikers Island who have experienced technical violations, people who have been released from Rikers Island to the community. So I want to thank all of you for joining this panel. As we know, the staunch spread of infection of COVID-19 has occurred inside of Rikers Island. We know that there are many, many cases that have occurred on Rikers Island that both impacted those who are detained there as well as the correctional officers. So the panel is rather diverse. I thought this with talking to someone who was actually just released from Rikers Island and has had the direct experience of witnessing what is going on there as a lead to that. So joined on this panel is Mr. Marcus Brown. Mr. Marcus Brown is also a part of the Fortune Society. So Mr. Marcus Brown, thank you so much for joining us today here for this webinar. And I just want to ask you, Mr. Brown, talk to our listening audience about what you experienced while you were in Rikers Island. We're thankful that you came out safe and that you came to a space where you were able to be supported. So talk to us, Mr. Brown, about your experience on Rikers Island, what you have witnessed while there as it relates to COVID-19.
You're welcome. First, I want to greet everybody with peace. My experience at Rikers Island was from January 10th to April 2nd when I was released. My story is quite extensive, and I know we have a brief amount of time, but I was in AMKC C95. And a week before I left, they had hung a letter on every door signifying that it was an isolated living area. This is after the last reports that there was over 100 inmates that tested positive and 100 officers that tested positive. I had access to the whole building, even after our house, each area was listed as isolated, meaning that we wasn't supposed to have no interaction with the rest of the population. However, through the policies of the building itself, we was allowed to interact with each other. They still ran medication. I was a mess hall worker, and I went to every house. This is how I actually saw that every house had an isolated living area on it. One of the experiences I had real briefly, do I have enough time, Andre? Or should I just go ahead? Well, one of the last experiences I have, I think that's most significant is that for those that's concerned about what actually took place on Rikers Island and how the virus was allowed to spread. We went to sick hall one day. And when we got there, there was 5 of us because that was the policy of the ward. Only 5 people could go at a time. They didn't have any apparatus to take out temperatures or anything. All they did was take out blood pressure. And I told them my lung was hurting. Other individuals had flu-like symptoms. They didn't take out temperatures. They just sent us back to the living area. And they didn't give us no medication or nothing like that. 2 days later, one of the individuals that went to sick hall with us, he fell out. And he ended up actually being tested positive for the coronavirus. At that time, first they were sending them from West Facility to Bellevue, but then they stopped. They opened back up the ETMC Center, which is C76, which they had just closed where city inmates used to be housed, or city sentenced inmates rather. But they opened that back up for those that were tested positive to quarantine them. And he was sent there. We was informed this by the officers that came back to get his property. That's just some of the brief things. I don't want to take up too much time, but my story is quite extensive, and I hope whatever information I have will be useful, and that something can be done further to better. Because I noticed they stopped speaking on the news about anything about Rikers Island, about what's going on. And when I left, in the building I was in, there was definitely, because that's why they hung the letter on every door, there was definitely somebody in every house that tested positive, because that's what that meant. And we were still allowed to interact with everybody. And we was even released. There was a segment of us that had symptoms. I had symptoms from the day I was released. So that means that the governor, 'cause I was released by the governor of the state of New York, or rather, the writ was put in for me by the New York County defenders. But the governor allowed 600 people to be released. The mayor allowed about 500 city sentence inmates. And there was a segment of that population who definitely was infected by the coronavirus that was allowed to be sent back to the community, thereby contributing to the infectation of our community, family members, and even a death rate, which definitely probably happened. But that was because of the policy and procedures. Whether it was known or unknowingly, I'm not trying to slander anybody, but I'm just going to end with that. And hopefully at the end, I can give some suggestions, but I think might be done, but that's probably irrelevant at this day and time, because the whole Rikers Island is probably infected entirely at this moment. At the time that I left, just my building alone. And when I spoke to other people that was released, they said the same thing was happening in their buildings.
Sure. Thank you for that. And I want to transition to Dr. Bobby Cohen for a minute. You know, when we're talking about mass exposure to COVID-19 on Rikers Island, right, it's noted that one person can infect 1.2 people, according to some of the research I've done. So Dr. Cohen, talk to us about that, like the impact of that exposure, right, and some of the implications there, and other comments.
I'm going to begin to say I'm speaking on my behalf, not on behalf of the Board of Correction. We have been publishing daily public information. We've been collecting other information for a longer period of time. We will try to increase the amount of public information that we have out. It is an extremely contagious disease. And right now, the Rikers Island is divided into essentially 4 groups. We all know, everybody here knows all the different categories that there are on Rikers Island in terms of disciplinary and ESH and MOs and CAPS and PACE. Fundamentally, there are people who are who have been COVID-19 positive. And right now in Rikers Island, there are 362 of them. This is out of a population of 4,000 plus or minus. There are 2,000 of those 4,000 who have been in dormitory areas like you just described, Marcus, where someone was found to be positive or suspected of being positive. And that dormitory is then labeled quarantined, possible exposure to COVID virus. We do not know how many people in your dormitory were infected by the person who was taken out. And then there are people who are symptomatic and are awaiting testing. And then there's the 4th group, which is everybody not in those first 3 groups. People who are positive, people who are symptomatic, waiting the results of testing, 2,000 people who have been exposed at some level because they lived in the same housing area as someone who was either positive or symptomatic, and then other people, which is
the symptomatic number.
What?
You said 2,000 are quarantined because they've been exposed, 362 are positive. Then there was another group of symptomatic. How many are symptomatic?
143.
How many?
143. 143. So the answer to the mental question here, Andre, is that I don't know how many people are infected on Rikers Island. The policy on testing, and again, I want to say that and I've been criticized for this, but the people in the medical services there and the people who are working there are doing an extraordinary job, despite what you described, Marcus. And I believe what you described happened, and I'm very concerned about it. But you know, there are 775 DOC staff who have been COVID-19 confirmed, and this is as of yesterday, and 123 members of the medical staff who become infected. So if you're there in Rikers Island, your chances of getting infected are very high. I think maybe there are other things I can talk about, but was that responsive to your question, Andre?
Sure, and thank you for that data, Dr. Cohen. We appreciate that. And I want to transition to Sharon White Harrington. And Sharon, and I apologize for not introducing you, Dr. Cohen, like your affiliation, but Sharon White Harrington is Executive Director for the Women's Community Citizenship. And I know that you work with, obviously, working to advance, lift up the issues that are impacting women, especially those who are Rikers, and in Bedford Hills upstate as well. So Sharon, talk to us about some of what's happening with our women. in Rikers, in Bedford Hills, etc.?
First, I want to say hello, everyone, and it's an honor and a pleasure to be on the panel with all of you. Not much, right? So, as always, women are always under-acknowledged, overlooked, underrepresented. And so we can't get a whole lot of information about the women that's upstate, right? They've been closed off. We have gathered almost all the resources that we know that we have, and it's not just WCJA, it's, a little piece of light, it's the Women's Prison Association, it's, New Hour, it's CC. I mean, we all have tried to, get some information on what's going on, right? And we can't get a whole lot. We got like 36 names of women who are over the age of 50, and we're talking about 3 state facilities for women. So that can't be accurate, So, right now we're still pulling teeth with the women. There's 166 women that is on Rikers Island at the Rose M. Singer Center. 17 of them are detained for technical parole violations. 6 of them are city sentenced, and 119 of them are still pre-trial. And 7 of them, from what we have gathered from the Board of Corrections update, that 7 of them are confirmed cases, and about 110 of the women are likely exposed but asymptomatic.
Yeah, and I know that it's really alarming, the lack of attention that's paid to women who are on Rikers and who are upstated in prison, especially our women who are among the aging population who are older. And so I know we're going to talk a little about parole, and I'll circle in with Lorenzo and obviously Vinny, who are like leading some things. And certainly we have Assembly Member Mosley who's joined us. Again, thank you so much, Assembly Member Mosley, for joining us too. And your feedback is critical to this conversation. As an elected official, you have been behind and supporting less is more, and by extension, parole reform, et cetera. We want to acknowledge you for that. But I want to talk to like our lawyers who are in the House, right? So we have Tahani Dunn and we have Corey Stoughton who are on the phone. And Corey, I'm going to turn it over to you. Corey, I know that you're heading up as the attorney in charge of the Criminal Defense Practice Special Litigation Unit at Legal Aid. I know that Legal Aid just won a victory with 51 people being released. Just really want to acknowledge the work that Legal Aid Society has done. And then we'll shift to Tahani for what Bronx Defenders is doing. But Corey, talk to us about that experience, right? Litigating to get 51 people released, folk who are a certain age, right, older population and have different medical conditions. Talk to us about what that experience is like and what you all are doing.
Yeah, thanks. So actually, all in all, we filed a series of writs for hundreds of people on Rikers Island, and all in all have gotten, including Mr. Brown, yeah, it's nice to meet you in person, Mr. Brown, and gotten actually 172 people released in total across all those writs. We haven't won all of them, so judges are denying some of our writs. These hundreds of people are all people who are medically vulnerable in some way according to the CDC criteria. So they could have asthma, they could have other conditions, or they could be of an age where their age makes them particularly vulnerable to bad outcomes from getting COVID. So, and we actually were following the lead of the Board of Corrections on this when, at the very, very early stages, the Board of Corrections came out and said, you need to release all these people who are over 50 and have kind of, other conditions that make them vulnerable. And that, the system wasn't really moving. So we started filing writs of habeas corpus, arguing that the constitutional right to be free from, punishment and to have your, to be free from what they call deliberate indifference to a serious medical need requires release, which is really, like, from a lawyer perspective, an extraordinary argument, because I think people probably know that in prisons and jails, you file constitutional claims like this if someone's very ill in prison and the prison is failing to treat them altogether. But usually what you get out of that is treatment, right? So there's lots of cases where prisons, won't treat someone with, say, hepatitis C. So you should be getting hepatitis C medication. This was a really kind of a step farther in asking judges to release people from jail because of the medical risk. And what we've seen is that some judges are willing to do that because they know it is necessary and it's an extraordinary circumstance. But we still see that many judges aren't. And that's really unfortunate. So that's one of our strategies. We've, more broadly, legal aid provides representation to the vast majority of people accused of parole violations. And one of the things that we saw that made this problem worse for the parole community is that after COVID hit, the parole system really ground to a halt. And that's because the hearing process was, for those of you who have been involved in representation or in the system, that the hearings take place on Rikers Island in these tiny little rooms. Social distancing is just not possible, and they're not the cleanest places. So because they didn't move quickly at all to try to make a system work to kind of keep cases moving forward, what happened was the system just collapsed for about 2 weeks, and nothing happened. And also during that period, a lot of people came into the parole system, because docs didn't stop violating people, even though people called on them to stop this, especially technical violations, stop feeding the system, where we know that Rikers is going to be a very dangerous place for people there and actually our broader New York community. Docs didn't stop. So we had people coming into the system, but there was no system. And to this day, there are many hundreds of people who are in Rikers now in technical violations who don't even have a lawyer because they kind of got lost in the system. And it's something we really remain very worried about, because we can't file writs on behalf of people when we don't know who they are or how to get in touch with them. And we get calls sometimes from family members or from people calling a hotline and legal aid hotline, but a lot of people are right now, I think, are really lost. So we're really worried about that. The governor, one of the things that happened was after we won our first writ for 106 people in on technical parole violations, about 5 hours later, the governor announced that he was going to review people in jails on technical violations. And that has now happened. And the governor says he's released about 700 people statewide, including about 264 at Rikers, although we think his math might be a little sketchy, but anyway, he has released quite a number of people. But they denied the vast majority of releases, even people who were just in on technical violations. And they did it, the criteria they applied were really restrictive. You had to, for one thing, just off the top, they weren't even considering anybody with what they call an M designation. So anybody with a diagnosed mental health issue, which, I think is extraordinary, because just because you have a mental health issue, I don't know why that means you should spend your time in Rikers. It doesn't make any sense. They didn't release people who, unless they could demonstrate housing, which is a really high bar for a lot of people to meet. And they weren't really, they haven't, anyway, they weren't, you had to come up with that on your own. And then they also applied, a public safety analysis that, I think probably just got that calculation wrong in a lot of cases. And we had some clients that we knew the records of, and we were baffled, really, that the governor was kind of resisting releasing them. So we tried to kind of pressure that system to move faster, and we keep trying to pressure it every way we can. We filed some other writs on behalf of people who were sentenced, parole, people involved in the parole system were sentenced to treatment, who then got stuck at Rikers when docs stopped transferring people. And we actually won the release. That was another, I think, 50 some people that we won. Actually, it might have been, I've got my numbers all mixed up, but it might have been 38 people. But anyway, several dozens of people who were stuck at Rikers who should have gone to Edgecombe for treatment programs, and we got them released. We tried to file a writ on behalf of people who've been denied their preliminary hearing, which you're supposed to get in 15 days, but we lost that writ, unfortunately. So we keep just trying to kind of push the system to kind of get more people out, as many people out as possible, because, for all the reasons that Bobby Cohen said and others have said, it's just a dangerous place to be. And the fact that we're feeding people in to the system at all is really outrageous, but especially that we continue to feed them in on technical parole violations. It's just mind-boggling.
Sure, and thank you for that, Corey. And I want to transition right to Lorenzo, right? Because you talk about pushing, you're talking about technical parole violations. the idea of less is more and the movement that's happening. Lorenzo Jones joins us from the Catal Center for Health, Equity, and Justice. They've been advancing less is more as it relates to technical violation and parole reform. And we're going to get to, obviously, our social scientist, Vinny Schiraldi, who has written extensively about parole reform generally. But Lorenzo, I want to tie into, like, segue away from what Corey's talked about into what less is more is doing, what Catal is doing with less is more. And then I want to get right to you, Assembly Mosley, following Lorenzo, because I know you're sponsoring the bill around the Less is More Act, and then we'll get to Vinny and others. So Lorenzo, talk to us about what the Catal Center for Justice is doing around Less is More. What is it? It's 11:25, just to let everyone know. We try to move as quickly as we can, but I want to make sure everyone gets in. So Lorenzo? And we have to unmute Lorenzo. I think we have to unmute him. My amazing colleague, Stephanie Geyer, who's on.
And fair enough, she unmuted me, but we both have a similar trigger finger. So I was unmuting at the same time she was unmuting, and I muted myself. Hey, it's Monday. Yeah. Morning, you all. I'll just be a couple of minutes. And I had to tell you, in the span of 5 days, probably the most significant thing we've learned is that the information the folks in Albany are getting about, and I'll let Vinny speak to this because he knows this stuff, and we had a great call Friday, but the information that our legislators are getting up in Albany is not the information and understanding, right, being shared with us, right, on the ground as far as numbers and infections and release. We had, unfortunately, 2 people pass, right, in the last couple of weeks. Like, that's been like a major thing for us. I'll let Vinny talk about the numbers because he can just speak to them with much more authority, but what we've done is activated our phone to action stuff. So people are online, find your legislator, tweet your legislator, call your legislator. We've had our staff, policy folks calling through legislators, calling through city folks and trying to figure out and talk to them directly and their teams directly around what we should expect for the back end of the session, what kind of things what kind of action we can be taking to, like, get their attention. And then lastly, probably the most concrete thing that we've done or found out, and this was in a staff meeting this morning, is not only our PEP have over 30 people, and I'm sure much more than that have been sent back for technical violations. People are being held there on, like, BS technical violations, but also now we've got the issue of the police, NYPD, making arrests under the stay-at-home orders for people who were kind of out, and, like, now we're looking at this other crap. So we went from, like, you couldn't do misdemeanor stuff, you couldn't, like, hold people for misdemeanor stuff, to almost like a resurgence of some of the ugly policies we saw done away with, like stop and frisk backhandedly. So I'll stop there and kick it to Vinny. But yeah, we're doing our organized on the ground. We're doing our Zoom meetings, as y'all all know, and working and following Rita's lead.
Yeah, thank you so much for that too. And I want to get to Assemblyman Mosley, who's on the call and on this webinar. And thank you so much, Assemblyman Mosley, as you're about to be unmuted, my colleague, Stephanie. Assemblyman Mosley, you've been a staunch advocate on bail reform. You've been really supporting and advancing, sponsoring Less is More, and just really committed to criminal legal reform advocacy work. We want to thank you for joining us. And I want you to share some remarks and comments relative to what we're discussing here today. Thank you.
Well, thank you, Andre, and thank you to all the advocates, and thank you particularly to Legal Aid and Catal. As you know, myself, along with Senator Brian Benjamin, have been spearheading this legislation in Albany. But clearly, with real-time events that are taking place, it really has, I would say, highlighted some of the dysfunctionality that we're experiencing here in Albany, particularly as it relates to CJ reform initiatives across the board. We had a great call with Catal early last week. And at the very end of the call, obviously when you talk about Albany and governing them, you have to include politics. And what was disheartening at the very end of the call, all up to that point, we were pretty much in agreement as to what we needed to do, what needed to be presented, and what efforts needed to take place. But at the end of the day, it takes 3 to tango. And in lieu of what took place with the rollbacks to bail, we understood that this would have a trickling effect on other CJ reform initiatives, regardless of the situation, regardless of what's happening in real time, regardless of what's happening with this pandemic and how it's impacting those who are in our CJ systems, that we would ultimately have to have not only my speaker, but also have the leader of the Senate come to an understanding that, you know, we have to push this piece of public policy forward. But at the end of the day, do we really have do we have someone of like mind and like will? I know the senator is, but I think in the back of his mind, he understands that he has to convince Andrea Stewart Cousins, and whether or not this is the politically prudent thing to do for them. And it wasn't positive. It wasn't something that he thought he could get done. And I don't want to go too far into what we discussed, but that's kind of like the elephant in the room when it comes to us possibly coming back in May, which we're hearing, and whether or not we can, you know, garner enough momentum and support, not only in our conference, but also in the Senate, to push this piece of public policy forward. But I'll just be very honest with you. I'm not going to say they can't do it. I'm not going to say they don't want to do it, but I'm very, very pessimistic that they will do it. So that's where we are right now. We'll continue to push forward. We'll continue to work with the advocates and legal aid and everyone else. But I'm also very pragmatic in terms of what's happening in real time and what are some of these, the kind of the political hurdles that, you know, that we're faced with. So thanks again. I appreciate everybody.
Thank you so much, Assembly Mosley, for joining this call, just for sharing those thoughts and that insight, which is really important for this conversation. I want to transition now to Vinny Schiraldi. Vinny Schiraldi is a senior scientist at the Columbia Justice Lab, the former New York City Commissioner on Probation. And so, Vinny, I know as an academic and a social scientist, like you've written extensively around parole reform. So talk to us about the relationship between like COVID-19, Rikers Island, parole, technical violations, that intersectionality as it relates to parole reform in particular. So talk to us about that, and thank you for joining us, Vinny.
Sure thing. Thank you for having me. And I want to start by dedicating everything I have to say to Michael Tyson and Raymond Rivera. They're the first two people that died coming out of Rikers Island, or in Rikers Island. Both of them were locked up for technical parole violations. And I want to be real careful about not sort of segmenting populations. Nobody deserves to die in Rikers Island. Nobody deserves to be in the conditions the people in there are in. The people who are incarcerated there or the people that are working there. It's truly, truly awful. It's, you know, we had Rachel Bedard, a doctor from Rikers Island, speak on our staff meeting last week, and it was just crushing to hear what she was talking about and how widespread the infection is, how impossible it is to socially distance, how impossible it is to be clean, how challenging it is to test enough people. And this is even, as Dr. Cohen said, when people are trying hard to do the right thing. So I want to say that because I know we're focused on technical violations and, you know, everything's got to have its own focus, but nobody, violent offenders, unviolent offenders, so-called, nobody deserves to be in unconstitutional, horrible, disease-infested conditions where they're forced to be proximate to other people. That said, New York is particularly bad on people who are locked up for technical parole violations. We're the second worst in the country, behind only Illinois. And that just depends on how you count, because there are 2,000 people that get locked up in New York every year who volunteer to go back to prison to treatment. Because if they didn't volunteer, they'd be held for a technical parole violation and most likely technically violated and given more time. So if you added those 2,000, we'd be number one in terms of locking people up for technical violations. Costs over $600 million a year. Money we could use right now to treat people, right now to house people, right now to help people get jobs and help them turn their lives around. But we are pissing it away, locking them up in dangerous facilities in New York City and around the state. So that's what's happening with that. Assemblymember Mosley and Senator Brian Benjamin have courageously authored the Less is More Act. It would dramatically reduce the number of people who are locked up for technical violations. It would give people recognizance hearings. A fascinating thing that Corey Stoughton could maybe talk a little about was how the state, in defending itself against their lawsuit, attached the Less is More Act and said, we don't need the remedies being asked for by legal aid, recognizance hearings for people who are facing time, because the Less is More Act has been proposed by Assemblymember Mosley, even though it hasn't been passed, even though the state hasn't endorsed it, even though the state hasn't done it essentially administratively, because most of what we're saying in Less is More, the parole board and parole division could do right now. They could stop technically violating people. 41 additional people have been sent to Rikers Island since the governor announced that he was releasing people on technical violations on March 27th. That's just in New York City. That doesn't include the rest of the state. So it's terrible for people to be in for any reason. If my husband or wife or daughter or son were locked up there, I'd be freaking out right now. It's especially outrageous when they're in not even accused of a new crime, because that's what a technical violation is. You're not even accused. So I get it that we have to struggle over who to release, right? I get it that there's another side to this discussion, that people are afraid of letting dangerous people out. I get that. Can't we categorically start by saying nobody comes into this place for a technical violation and everybody who is in on it goes home? And last point, the governor's order to release people. First of all, only half as many people have been released from Rikers as the governor said he would release. And second of all, it doesn't touch the remaining 4,000 people in state prisons who are in on technicals. You know, the doctor at Rikers, Dr. McDonald, said that a storm is coming. And a storm is indeed coming. It's actually hit Rikers and it's going to hit all the state prisons. Some of it's already hit. But you know, when there's a hurricane coming to your house, you don't wait till those 100-mile-an-hour winds to take out the plywood and hammer and nails and start boarding up the windows. You board up the windows when it's coming. And what we're not doing is that. We need to get as many people out of state prison, and that includes elderly people, that includes not just technical violators, it includes people who are just short of finishing their sentences. Get them out of there so that when the storm hits, not if the storm hits, when the storm hits, there's enough people to go around, there's enough space to go around, you have more, a better staff to incarcerated person ratio, you have more healthcare providers, you're able to provide healthcare in the upstate hospitals that people are going to have to be rushed to if they get really sick. All this stuff is knowable. We know it now. And if it hits, it should not be considered a surprise when it starts. I'm in Lake Placid right now. There's 4 prisons I can spit to from where I'm sitting, and there is not one hospital that I can spit to. If those people start getting sick and they need to be rushed to hospital, staff and incarcerated people, where are they going to go? Where are they going to go? We need to reduce those populations now. Otherwise, it is going to be an absolute bloodbath in these places.
Sure, and I want to thank you for those comments, Vinny. I want to transition to Tahani, if I'm pronouncing your name correctly. I want to transition to Tahani, I know, and then we'll get to Sarita, who's heading a lot of advocacy work at Just Leadership, to close off before we get into some Q&A, and then we'll have some final comments and calls to action from each of you. But Tahani, I know that you're heading up some of the prison rights advocacy work or attorney work at Bronx Defenders. Like, talk to us about what you're hearing as you're engaging people who are coming out and just what you're hearing overall.
Sure. So I just want to say thank you for having me. I also want to send my condolences to Mr. Tyson and Mr. Rivera's family. It's very sad that their fate, was what it was, considering the fact that they could have been released if the governor had acted quicker. So, Bronx Defenders, as well as Legal Aid, we have been filing a number of different types of mass writs as well as individual writs. We have had some success. But not as obviously not as much as we would hope. The standard is a little bit hard to sort of meet, as Corey mentioned. It's a high standard you have to show indifference on the part of DOC to the health and safety of people who are incarcerated. And one of the things that we're seeing is judges are very resistant to release people, because their sort of logic is that if they were to find that standard for one person or a few people, they would essentially be finding that standard for everybody in there. And they're just not going to release everybody who is on technical parole violations or city time or pretrial, whether they're medically vulnerable or what have you. So we're seeing a lot of pushback in that way, and we're also seeing judges really attribute a lot of credibility to the affidavits that are coming from DOC and the DOC lawyers and the letter from the district attorney's office, which essentially is saying, don't worry about it, we're doing everything that we can, we have this under control. And that's just literally not true. So, I mean, my day, 7 days a week, pretty much every single day since I would say probably the beginning of March, has been spent speaking to my incarcerated clients, initially in person when we were still doing visits on the island and also at MDC. And now, on the phone and video conferencing and listening to them cry, listening to them, ask what else can be done so that they don't die in prison. And some of these people are in on parole holds, technical parole violations, but there's confusion, there's mass confusion in the jails. They don't know what's going on. They don't know why they can't be seen when they're calling for sick call. They don't understand why they don't have masks, despite the fact that, the mayor had mandated that everybody in DOC be given PPE. They don't understand, why they're being housed with sick people. There's no information sharing, and that's not just with the people who are incarcerated, right? Like that's also with the COs. The correctional officers also don't know what's going on, and so inevitably there's a lot of mistakes and poor judgment being exhibited, and unsafe practices, and practices that are just sort of coming to be out of just fear of everybody on the island. One of the things that has been a challenge for our legal department who have been filing the writs is just collecting data. Like everything that is going on right now is so fluid. And for almost 2 weeks, we didn't have access to our clients through video conferencing. And so once that sort of came up and running, then we were able to check in with people, but there was a backlog in terms of getting to speak to people. But, the CHS has been phenomenal in terms of making sure that we did get information on our medically vulnerable clients for purposes of individual and mass writs. But generally speaking, it's just been really, really hard to communicate with people and just not knowing what to say to people, when they've received an ACD or they've, taken a technical violation for a criminal case that resolved, but they're still sitting there in a parole hold, and they have asthma or, they have respiratory issues, but somehow, some way that's not enough for them to be released. So it's confusion, it's trauma. And it's sadness and it's hopelessness. The conditions in Rikers are deplorable, even prior to COVID-19. We've heard about people not having running water. They certainly can't have sanitizer because it's considered contraband. There are people who are in quarantine dorms who they're with other people who are visibly symptomatic, and their beds are spaced 1 to 2 feet apart. People are getting coughed on. They're having to, people who are in solitary confinement, I do a lot of work with people who are in solitary confinement, they're saying that the slots that they receive their food and their mail through are never wiped down. And the people who are serving them their food are coming from other quarantined units, meaning that they've been exposed to somebody who had COVID-19 and they're not using gloves. And so we've seen people, in solitary confinement who you would think wouldn't have much contact with anybody to get it, who are actually being diagnosed or being, tested positive for COVID. Same thing with phones. We have to be very careful about, asking our clients to call us a video conference with us, because every time they are moved somewhere else, they're exposed, and there's not alcohol swabs to wipe things down. The video booths and the phones are not being disinfected, and the incarcerated people who are in there don't have access to that stuff to do it themselves. So it's a very scary, confusing, hopeless, I think, time for people who are in there, and their concern is just not dying.
Sure. And thank you for that, Tahani. And I want to transition right to Sarita Daktari Steele, who is obviously the senior community organizer at Just Leadership USA. And I know, Sarita, you and others at Just Leadership have been major proponents of decarceration and reducing the amount of people on Rikers Island prior to COVID-19. So now here we have COVID-19, Sarita. And so talk to us about what's happening, the work you all are doing at Just Leadership to really continue to keep the decarceration in existence, and how you all are responding to COVID-19 during this time.
Thank you, Andre, and thank you everyone for everything that was already shared. Makes it easy to know that so many important things have already been covered. So at Just Leadership USA, we've been leading the campaign to close Rikers, along with many other powerful partners.
Yeah, so Sarita is frozen on us, and when she comes
For a while now, and it is not.
Yeah, you're freezing up a little bit, Sarita. Yeah, you're frozen right now. And so we also, while Sarita gets back to us, we have a series of questions that are here that we'll try to get to in our very limited amount of time. And then we'll close off with some calls to actions from each of you. Sarita, are you there?
Yes, can you?
Yeah, you're in and out a little bit, but please share your thoughts.
Okay. Sorry, I'll do my best.
All right.
So we are. Can you hear me?
Yeah, we can.
Okay. So Just Leadership USA has been since the
Yeah, and this call
outbreak of COVID-19.
Mm-hmm. Go ahead, Sarita, I'm sorry.
That's okay. Okay. Should I try to turn off my video if that helps?
Yeah, that may be helpful.
Okay, I'm gonna try that. So I'll without you being able. We've been working on as many people released as possible, as fast as possible, and many folks on the call already described a lot of the reasons for that and a lot of the ways that it could happen. We have been convening bi-weekly calls with folks who are working on getting people released from Rikers, just being able to, share information about what we're hearing, what's worked, what hasn't worked. And one thing that I want to just note about parole that Corey touched on, and many people touched on, but in the declaration from docs that excluded people with serious mental health needs, or who had ever been designated as having mental health needs, and excluded so many categories of people, is we see that, parole is excessively punitive and racist in the same way that the rest of the system is, but with a lower standard of any kind of due process, right? It's like a shadow system that's even worse than the system that most people may know a little bit more about. So, and in terms of thinking about how to respond to that, and I saw some questions in the chat about calls to action. We have a page up on our website right now that I'll put in the chat. It's jailusa.org/freethem-now, and just different call scripts and targets to reach out to. But this is something that absolutely sits both in the governor's hands and the state legislature in the way that they can address it legislatively, and also in the mayors. And I'll explain why through one example. So one of the people who we've gathered stories from people who have loved ones in Rikers right now, and are doing this sort of series of profiles to put a human face on this, to really acknowledge the humanity of people who are facing this horrible situation on Rikers. So one of those gentlemen who was just released on Sunday was arrested in August when police stopped him looking for a stolen credit card, found his wife's credit card in his wallet, did not even call her, arrested him because he was on parole. He was, brought to Rikers Island. The original case, his, a dollar bail was set. It was paid months ago. He was still being held just by parole because of the police contact. So, when you look at the numbers of people that are on Rikers, there's people who are there purely on a technical violation. And the governor could just lift all those warrants and could, address the system more broadly by passing less is more. But for all the people who are there with a technical violation and a new case, or even if it doesn't rise to the level of a new case, but like a summons, any amount of police contact means automatic incarceration for people who are on parole. And so I think that's an important piece to acknowledge, is like, both the shared responsibility, but the shared opportunity for them to do something about this, both at the state and the city level. So a couple quick calls to action that I wanted to mention. I said I'll include that link with the call scripts in the chat, but also there's a group of mental health advocates across the state that are organizing a letter to send to docs expressing concern with their policy of excluding people with mental health designation from eligibility for parole release. That's a complete, violation of disability rights and is just not right, period, from a human rights standpoint.
Sure.
And then also just in terms of what I mentioned in terms of broken police contact and over-policing and broken windows policing, we need a lot of change in our system, and one of the things we need is less police total. And that's a hard sell, but we need to get there somehow. And when we are looking at budgets that are so strained that we may need to cut social services if we don't do something else, it is the time to do something else, at minimum a hiring freeze for the NYPD. So we have a sign-on letter that we are pulling together around really talking about the way that the budget sets priorities and the need now more than ever to really invest in supportive social services and divest from law enforcement. So we would be glad to have organizations join us in sending that message to the mayor.
Thank you so much, Sarita, for that too. And there is like some questions, one of which has to do with support around housing, right? People leaving Rikers to safe and stable housing is something that's really important to this discussion too. And I don't know if anyone has any comments on that. We only have 8 minutes left. And so I know the calls to action is really, really important too. And I know that the questions are equally as important. So I'll ask people to take a quick 30 seconds if they want to respond to housing for people obviously who are being released from Rikers. If you care to share a comment about that. And then we'll jump right into the calls of action before we end this webinar. We never have enough time, but anyone wants to kind of respond to that?
Sure.
Go ahead.
I'll respond really quickly. One of the things that I will note as a former civil action attorney working with people who are experiencing collateral consequences, and something that hasn't really been spoken about much, but these people who are leaving Rikers Island or being released from Rikers Island do have families that will take care of them. There are ways for them to come into the community and quarantine, but a lot of those people live in public housing, Section 8, project-based Section 8, NYCHA, and there are restrictions and permanent exclusions or just exclusionary policies and procedures in place for public housing that do not allow for people who have those vouchers or who subsidies in city housing to receive their loved ones back home. In fact, it could actually initiate or prompt a termination proceeding for that person, whereby they would end up either being kicked out of public housing or lose their voucher permanently or for a period of time, or they would have to opt to what's called permanently exclude their loved one. And so one thing that I would say is it is a way for the city government and the state government to sort of address this issue is to, I would say permanently eradicate those, policies and procedures, but certainly suspend them for the time being, especially because homeless shelters are at capacity, hospitals are at capacity. It doesn't serve anybody for people coming out of jail to be on the streets. And hotels are being used, but sparingly, and it still costs the organizations in the city a lot of money to be able to put people up in hotels or in hostels or what have you. So that is one thing that I think needs more attention, is the issues around public housing subsidies, city housing, that kind of stuff, and their policies and procedures around receiving people who have convictions on their records.
Got it. And I want to get to calls to action. We have 5 minutes left. Calls to action in 30 seconds as we wrap up. I want to turn this to Mr. Mark, Mr. Brown. And Mr. Brown, again, thank you so much for just sharing your experience with us. We really value it. It's really impactful, and it makes a difference hearing your story around doing this. So Mr. Brown, in 30 seconds, a call to action. What should be done?
Well, I'm one of the individuals that's housed in the hotels because I'm in the shelter system, so they place it in hotels. Well, first call to action is you to test people. We begged and begged to get tested. They never tested us. The only way you got tested is if you ever went to West Facility. And another thing is that when I left, they was not allowing officers to wear protective gear. I saw an officer come in with her own mask and a white shirt, which was a depot or a captain, told her she could not do that. So they wasn't allowed officers to wear protective gears. Not to protect them, but to protect them from us, because we're inside. But one of the calls to action is to test it, because it's quite easy to test those to see who's actually infected and separate them from those that's not. In my housing unit, when I was released, it was 10 to 12 of us that had symptoms, and it was already 2 people that were taken out. But here's the kicker. When they designated these houses isolated living area in C-95, they still allowed everybody to go out to medication to interact. And the virus is known to stay on certain services 2 and 3 days. So even though they ran one house at a time, they still was allowing the inmate population to go out. I was a mess hall worker, so I was allowed to go out and work with food even after my housing unit was designated an isolated living area. These policies and practices allowed the virus to spread a whole lot faster than it would have. There was preventive measures that could have been taken with the knowledge that they had. Sure. And so testing is very important. And like I said, all of us that were let go, that were released, whether it was by the mayor or the governor, I was released on a writ. One of the writs, the New York County defenders, because of my medical condition, I'm missing half a lung. They didn't test none of us. Right. And there's a segment of us that was definitely infected. Though I was never tested, I had flu-like symptoms, and I saw people around me. So therefore, we were never tested, but released back in the community. And those of us that were infected would have passed it to our loved ones, and they would have passed it on to where they was going to their love, and it was continuous. It's like a spread. And I'm not saying that this was done intentionally, but knowledge was present that could have told you, just common sense, that
Sure.
you can't do this. And with that, I'll end.
Thank you, Mr. Brown. Corey, 30 seconds. I know it's not enough time, but some calls to action. And Corey's on mute. She just has to mute. Corey. Stephanie, can we unmute Corey?
Okay, there we go, got it. Okay, so I would just say 2 things, picking up on something someone else said earlier. We got to think about the immediate around COVID. We need more releases. That's the first thing. And we also need to stop feeding the system. And that gets to the policing issues Sarita was raising, and also the fact that DOCS is continuing to violate people for technical violations. Why? I mean, public safety includes our safety from this virus. Arguably, that's the most important aspect of public safety right now. And the notion that we're violating people for missing meetings or having a dirty test is outrageous. And it's a really challenging time right now, because I got to tell you, most people who aren't following this issue the way you all are by being here listening to this webinar, I think this problem is getting solved. They see that the Rikers population is down to 4,000 people. It's down 25% from where it was a month ago. That's an incredible accomplishment, but it's not enough. But a lot of people think it's enough. And they heard the governor make an announcement that he's releasing people. They think, okay, it's taken care of, but we've got to keep hammering that message. We're also, if I can just be real, we're starting to see the Willie Horton effect. We're starting to see the stories come out about people who have reoffended after being released. And it's just, we're in a really challenging moment. And if we don't keep that pressure up to continue to release people, we're going to lose that momentum, and there will be more people who die already. So that's really one thing. But the second thing is that long-term thing that someone said before, that the parole system in particular is just an incredible black hole. And if we don't take this moment now to ask ourselves, why do we have a system that is crazy this way? Why do we lock up this many people like that? We need to get less is more past. That's what needs to happen right now. So I think both the kind of fix the foundation problem that led to what a travesty this is, and also respond to the immediate need.
Sure. Dr. Cohen?
Yes. You know, first to honor those who have died and to remember them. That's to keep us engaged, and so that we won't keep the pressure, let the pressure down. Very locally, the city should be doing a lot more testing. They should be testing everybody who's coming out, as you requested, and they should be testing. And they should be providing information to all of us about how many tests they are doing, how many are positive, how many are negative, so we can actually understand the nature of this epidemic. They should be publishing data on how many people are hospitalized, and they should be publishing data on how many people are on ventilators in the hospital. And we can't move away from that, but I do think that there's an opportunity within the state to echo all the comments that have been made here to prevent the horror that's going to happen in New York State prison. So we all have to work on that as well.
Sharon? Thank you, Dr. Cohen. Sharon?
I just really piggyback off everybody else. I think there should be testing for all, releasing of pregnant women, release women and children, people who have made their board, close to their board, year to their board, who are medically compromised. And we also need more resources to keep people out of incarceration and that they stay out. So we need to gather those resources as well, because we can advocate for all of that, but it's important that we keep them out. So we need those resources to come together.
Sure. Lorenzo?
Thank you.
Yeah, we've got to say in organizing, you don't win because you're right. You win because you're strong. So like, we have to get stronger here, right? Our organizing's got to be stronger. I invite people to participate in our phone to action tool that's on at catalcenter.org. I encourage people to actually go up and read the NYCLU and Legal Aid stuff that they're putting out here, the Brennan Center stuff, and understand that the data would get, obviously this is preached to the choir. The information that we get, I could read you a bunch of stats that make docs sound like they're doing something. And just to bring into this conversation, Donna, right, who's a friend and ally, and we all know Donna. Like, don't assume that a release strategy here accounts for or gives a shit about, right, women and like what's happening around their survival and like their reentry. Donna walked through some stuff on Friday that blew people's minds that women are going through in this situation. And while we're talking about the things that's impacting everybody, we're not talking about the things that's impacting everybody. And I want to tie that back to Sharon's point, tie that back to Donna's layout from Friday, that we gotta have and pay very special attention to. And if you haven't, like, what's happening with like women like in this situation, inside and home. Because they're also the folks who are the head of the households who are receiving people who are coming home.
Mm-hmm. Yep. Thank you. Assemblyman Mosley, any calls to action? Stephanie, if we can unmute Assemblyman Mosley.
Yeah.
There you go.
Obviously, everything that everyone said thus far, I will co-sign off of. I think the most important thing for me, from a legislative standpoint, is to put pressure on leadership. I know Speaker Hasty, criminal justice reform is the thing that he believes he'll be judged upon, his effectiveness of his leadership as Speaker in the Assembly. I can't say the same for Senator Andrew Stewart-Cousins, but we have to make it a priority of hers. We can't allow for a small minority of senators to dictate how criminal justice policies will go through the legislature. But that's what's happening now. And I think they got away with it during the budget process with bail. They believe they'll continue to get away with it even in the midst of what we're going through, if we don't continue to press them, continue to press her. So when we get back to Albany MA, that this is a priority and is on the agenda to be addressed legislatively. If we don't do that, regardless of what we're doing in our individual silos or in a coordinated fashion, the legislation, which will have a far more impactful, it will be far more impactful throughout the state of New York, won't get done legislatively. So to me, I think we need to continue to pressure the leadership, pressure our colleagues individually, find out where they stand on this issue, and make it publicly known one way or the other. So that's my position from a legislative standpoint.
Thank you. Vinny, close and call to action. And Stephanie, can you
we finally got the Democrat House legislature, Senate and Assembly, and Governor's House. And the only thing we did this session was add more people to incarceration. That's completely unacceptable. Less is more has 6 district attorneys supporting it, several sheriffs, the New York State Association of Counties. This is hardly radical stuff to not incarcerate people who haven't broken any new laws. We need to pass less is more. Catalcenter.org, as Lorenzo said, has information about how to help. And Assemblymember Mosley's right. For example, the next committee this is going through is Assemblymember Weapons Committee, and not even every Democrat on that committee has sponsored less is more. So go to Catal's website and link through to the bills. You'll see who is and is not sponsoring it, and put some pressure. Email those folks and say, sponsor less is more, so that the leadership knows this is important in both the Senate and the Assembly. Meanwhile, by the way, the governor can give clemency to all those people in on technical violations. The governor can tell his parole board this afternoon to stop adding any more people to a jail where everybody seems to be infected because they missed appointments or peed dirty. So those things can happen tomorrow. This session, we can pass less is more. This was lousy public policy before the pandemic. It didn't just get bad. It got bad and deadly with the pandemic, but it was bad public policy before this, and we need to do something that ensconces good public policy around this issue from now on.
Yep. And Tahani, we'll close with you. Any call to action?
Yeah, I mean, again, echoing what everybody has said, I think that if this, some of the policies that we're talking about are not radical policies, but I think that if this time period is not radicalizing people, I'm not sure whether people are actually paying attention. But like the mayor certainly can release more people from Rikers. The governor can absolutely release more people who are in on parole violations and technical parole violations. Him and his staff can be more clear about the process that release goes through. It was a little misleading when they said they were just going to release 1,100 people, and that was not actually what happened. And he can start directing, the parole board, or give them direction to stop continuing to violate people, to expedite, parole hearings, to just, restore people's parole, or just take them off of parole altogether and release them. It really, now is the time to really start to pay attention to already broken policies that have not served the public for quite some time. And it certainly has not served the public in terms of public safety. So, continuing to do the same thing that we have been doing, it doesn't serve public safety even in a time of pandemic. So.
Sure. I just want to thank you on behalf of the Fortress Society. I want to thank all of you for joining this panel, for sharing your analyses, the calls to action. Obviously, there are many, many other organizations and coalitions that are doing this work, and I want to acknowledge all of them. I'm not going to say them by name necessarily because I don't want to miss anyone. I know that all of the coalitions and organizations that are doing criminal legal reform work are critically important to this movement, and we want to take the time to acknowledge all of you. We know tomorrow, I think RAP is going to be going to Bedford, I think it's to Bedford Hills, I think tomorrow, to protest in their cars, right? Doing that kind of work is important. So we want to make sure that for all those who are listening, if you're not a part of a coalition, please join the coalitions and organizations that are doing policy and advocacy work so that you can become an informed constituent. You can begin to put pressure where it needs to so that we can advance the things that will make things better for our people who have been impacted by the criminal legal system. Again, thank you all, colleagues and leaders on this panel. We certainly look forward to having this again from the Fortune Society on other issues. Please be safe. Please be well. Again, thank you.